Welcome to our YouTube channel. Remember to like this video, subscribe to our YouTube channel, and share this video with everyone you know. If you want to buy a book with OET speaking tasks directly from Amazon, click on the first link in the description of this video. Good morning! It's a pleasure to meet you. My name is Dr. Jones, and I'll be taking care of you today. Before we get started, may I please confirm your name? It's important to me that I address you correctly throughout our conversation.
Yes, of course. You can call me John.
Thank you, John. It's great to meet you. Now, I want to make sure I understand exactly what's been going on with your health. What brings you into the clinic today? Please feel free to share as much detail as you're comfortable with. I'm here to listen and help.
Well, doctor, I've been having this persistent cough for about a week now, and it's really been worrying me because it seems to be getting worse, not better.
I'm really sorry to hear that you've been dealing with this, John. I can imagine how uncomfortable and concerning it must be, especially if it's been getting worse over time. If you don't mind, I'd like to ask you a few more detailed questions about your symptoms to get a better understanding of what might be going on. Would that be okay with you?
Not at all, doctor. Please go ahead.
Thank you, John. Let's start with the beginning. Can you describe how this cough started? Was it sudden, or did it gradually develop over time?
Well, it started pretty suddenly. I was teaching a group of teenagers at school, and they were being really noisy. I shouted at them to get their attention, and almost immediately after that, I started coughing. Since then, the cough just hasn't stopped.
I see. That must have been quite startling for you, especially since it's persisted for so long. Besides the coughing itself, have you noticed any other symptoms that might be associated with it? Like any mucus or phlegm when you cough?
Yes, actually. Whenever I cough, there's this yellow mucus that comes up. It's pretty thick, and it feels like it's clogging up my throat.
Thank you for mentioning that, John. The presence of yellow mucus can sometimes indicate an infection, so it's good that you're aware of that. Have you experienced any fever during this time, particularly at night or when you're trying to rest?
Yes, I have. The fever seems to come on mostly at night, when I'm trying to sleep. It's been really hard to get a good night's rest because of it.
I'm sorry to hear that, John. Fever, especially at night, can definitely disrupt your sleep and make you feel even more run down. I'm glad you've mentioned it because it's an important symptom to consider. Have you tried taking any medication to help manage the cough or the fever? If so, what have you used, and how effective has it been?
For the cough, I've tried drinking tea with honey, hoping it would soothe my throat, but honestly, it hasn't helped much at all. For the fever, I've been taking ibuprofen. It works for about 5 or 6 hours, but as soon as it wears off, the fever comes right back.
Thank you for sharing all of that, John. It's really helpful to know what you've tried so far. Based on the symptoms you've described and my physical examination, my initial diagnosis is that you might be dealing with a pulmonary infection. The tea and honey, while comforting, won't address the root cause of your symptoms. And while ibuprofen can help reduce the fever temporarily, it doesn't treat the underlying infection. To properly treat this condition and help you fully recover, I would recommend starting a course of antibiotics. Antibiotics will target the infection directly, helping to clear it up and prevent it from recurring or leading to more serious complications.
Well, doctor, to be honest, I'm a bit afraid of taking antibiotics.
I really appreciate you being open with me about your concerns, John. It's completely normal to feel apprehensive about taking medication, especially when you've heard things that might make you wary. Could you tell me a little more about what specifically concerns you about antibiotics? Understanding your worries will help me address them better.
Yes, I've read some things online and heard people talk about the side effects they've had after taking antibiotics. Some of the stories are pretty scary, and I'm really not keen on going through something like that.
I understand where you're coming from, John. There's a lot of information out there, and it can be overwhelming, especially when it comes to medications. It's true that antibiotics can have side effects, but I want to reassure you that the side effects are generally mild and temporary. Most people experience very minimal discomfort, if any at all. In comparison to the benefits, namely treating the infection, relieving your symptoms, and preventing any further complications. The potential side effects are usually quite manageable. Antibiotics are very effective at treating bacterial infections, and they're the most direct way to help you recover and get back to feeling like yourself again. After hearing this, do you feel a bit more comfortable about starting the antibiotics? Yes, I think I do, doctor. It helps to know that the side effects are usually mild and that the antibiotics will really help me recover. I'm really glad to hear that, John. Your health and comfort are my top priorities, and I'm confident that this treatment will help you start feeling better soon. In addition to the antibiotics, I'd like to offer you some advice on how to take care of your voice, especially since you mentioned that you're a teacher and use your voice all day. It's important to drink plenty of fluids to keep your throat hydrated. Try to speak more slowly and avoid shouting as much as possible to prevent further strain on your vocal cords. These small adjustments can make a big difference in helping you recover and avoid future issues. How does that sound to you?
That sounds like good advice, Doctor. I'll definitely try to follow those tips. I hadn't really thought about how much I use my voice during the day.
I'm glad you found the advice helpful, John. Your voice is one of your most important tools as a teacher, so taking care of it is crucial. Now, before we wrap up, I want to make sure you're comfortable with the plan going forward. I'm going to give you a prescription for the antibiotics, and I'd like you to start taking them as directed. It's also important that you take the full course, even if you start feeling better before it's finished, to ensure the infection is fully cleared. Additionally, I recommend that you rest at home this week to give your body the best chance to heal. I'll provide you with a doctor's note for your employer, so you can focus on your recovery without worrying about work. Does that all sound good to you?
Yes, that sounds great, Doctor. I really appreciate your help and advice.
It's my pleasure, John. I'm glad we could discuss everything, and I'm here to support you throughout your recovery. I've scheduled a follow-up appointment for you in a week, so we can check on your progress and make sure the treatment is working as expected. If you have any questions or concerns in the meantime, please don't hesitate to reach out. I'm always here to help. Here's your prescription and your doctor's note. Take care, and I'll see you in a week.
Thanks a lot, Doctor. I feel much better about everything now.
You're very welcome, John. I'm happy to hear that. Take good care of yourself, and I look forward to seeing you next week. Have a great day. Thank you very much for watching our video. Remember to like this video, subscribe to our YouTube channel, and share this video with all your friends and coworkers. Have a great day, and I will see you in our next video.